In the abdomen, I have external oblique, internal oblique, and the transversus abdominis. So in the chest, I will have external intercostal, internal intercostal, and innermost intercostal. And the innermost intercostal is divided into three muscles. Here is the innermost intercostal, which is divided into three muscles. The first one is called transversus thoracis. Okay, transversus thoracis. Then I have subcostalis and the sternocostalis muscle. Sternocostalis is related to the back of the body of the sternum, while the subcostalis is related posteriorly to the thoracic vertebrae. Okay, and the transversus thoracis is the inner to the internal intercostal. Then I have the three muscles: external intercostal, internal intercostal, and the innermost. External intercostal, which fibers are passing downward, forward, and medially from the inferior margin of the rib above to the upper margin of the rib below, from above to below. Okay, then it is responsible for, I have external intercostal for inspiration, while the internal intercostal for expiration. So please focus. Internal, not with inspiration, no in with in. Okay, so external intercostal is responsible for inspiration, while external intercostal is responsible for inspiration. Okay, internal with expiration, external with inspiration. Then external intercostal fibers are passing downward, forward, and medially from the rib above to the rib below, and it continues anteriorly as anterior intercostal membrane, while the internal intercostal passes from rib above to the rib below, downward, backwards, and laterally. Here is the external oblique, downward, forward, and medially, and here is downward, backward, and laterally. Responsible for expiration, while the innermost, I say it, three muscles, the most important is the transversus thoracis. Transversus thoracis, which is arising here from the angle here of the rib, then anteriorly it reaches before the anterior intercostal membrane. Okay, all of the muscles are supplied by intercostal nerves from T1 to T11. From T1 to T11. So please keep these muscles. Here, very important to know the course of the typical intercostal nerve and the course of the typical intercostal artery. I will show you, and we will discuss intercostal arteries in details. Here, you will see, here is the anterior rami, which are giving the intercostal nerve. Then, posterior ramus, this is the posterior, while it will continue by anterior. Anterior passes in first between the pleura and the posterior intercostal membrane, which is formed of the internal intercostal muscles. I have pleura and posterior intercostal membrane of internal intercostal muscles. Then it passes between this muscle. This muscle is the transversus thoracis, and this muscle is the internal intercostal, and this muscle is the external intercostal. The site of passage of the intercostal nerve in the thorax is like in the abdomen, because in the abdomen it passes between internal oblique and the transversus abdominis. And in the thorax, it passes between internal intercostal and transversus thoracis. So please keep this. Intercostal nerves and subcostal nerve in the abdomen passes between the internal oblique and transversus abdominis, and in the chest, it passes between internal intercostal and the transversus thoracis. Then here, it gives lateral branch. It's called lateral cutaneous branch of the intercostal nerve. Do remember, we have nerve which is the lateral cutaneous branch of T2. It is called intercostobrachial nerve, which is supplying cutaneous innervation to the floor of the axilla, which is called the armpit, which is supplying the armpit. It is the lateral cutaneous branch of the T2. Then it continues forward between the transversus thorax and the internal intercostal to give you the anterior cutaneous branch supplying the anterior part of the chest wall. Here is the course of the typical intercostal nerve from anterior primary rami between the pleura and the posterior intercostal membrane, then between internal intercostal and transversus thoracis, giving lateral cutaneous branch, and of T2 it is called intercostobrachial. Then it continues anteriorly to form the anterior cutaneous branch. And it is the same course of the intercostal artery. Because the intercostal artery here, posterior intercostal, from the descending thoracic aorta, lower line posterior intercostal, then it passes also between the pleura and the posterior intercostal membrane, then it passes here between also the internal intercostal and the transversus thoracis. And very important arrangement of the structures which found below each rib. Below each rib, you should keep the structures are found in this arrangement: intercostal vein, intercostal artery, and the intercostal nerve. So these are the arrangement of the structures which are found below the rib. So while you are inserting a chest drain, I have rib here, and the structures are here. Then I have another hip, and structures are here. Another rib, then structures are here. So when you are inserting a chest drain, please focus that you will feel the upper border of each rib to insert the chest drain. So you will put the chest drain above this, or above this, or above this. Don't go below the above rib. If you go below the above rib, you will injure the neurovascular bundle, which are intercostal vein, artery, and nerve. Then let's go for arterial supply and venous drainage of the chest wall. These are the intercostal arteries and intercostal veins. The intercostal arteries, I have 9 pairs of the anterior intercostal. I will go with them. I have 9 anteriorly and 11 posteriorly. Okay, I have 9 anterior and 11 posterior intercostal arteries. The 9 anterior, we will go for, I will give a blank page to draw all of them. Here is blank one. I have the arterial. Okay, I have arterial supply, anterior and posterior. Okay, anterior, I have 9, and the posterior, I have 11. Anterior, I have 9, upper 6, and lower 3. Upper 6 are from internal mammary artery. From which is the internal mammary artery? From subclavian, giving vertebral, internal mammary, cervical, costocervical, and dorsoscapular. And the lower 3 pairs, anterior pairs of the intercostal arteries, are arising from musculophrenic artery. From which is a musculophrenic artery? Internal mammary artery at the level of the 6th rib, after it ends here, it gives you 2 branches: superior epigastric and musculophrenic artery. So anterior intercostal artery, you should know their origin. Upper 6 anterior intercostal from internal mammary artery, while lower 3 anterior intercostal are from musculophrenic of internal mammary artery. Then it is easy. The posterior, I have 2 and 9. The 2 are arising from superior intercostal, from which is the superior intercostal is arising from costocervical trunk. Do you remember this name? I say branches of the subclavian. Here is the costocervical trunk. Superior intercostal from costocervical trunk from 2nd part subclavian artery. These are the first 2 posterior intercostal, while the last 9 are from descending thoracic aorta. Descending thoracic aorta. So please keep this. Here is arterial supply of the anterior chest wall. Anterior are 9, upper 6 from internal mammary, lower 3 from musculophrenic, while posterior, upper 2 superior intercostal from costocervical trunk from 2nd part subclavian artery, and lower 9 from descending thoracic aorta. Then let's go for venous drainage. To keep it also, I will try to simplify it, but venous drainage is slightly complex than arterial. Then I have on the right side, on the left side, posterior. I will start by posterior surface, right and left, because anterior will go through the corresponding artery. Anterior, upper 6 will go through internal mammary vein, through which it will drain into innominate vein. Internal mammary, I, through I, innominate vein, upper 6. While the lower 3 into musculophrenic vein, into internal mammary vein, into innominate vein. These are the drainage of the anterior chest wall. While the posterior, which is the most important, here I have right and left. Right, I will divide them into, they will be also 11 and 11. I will divide into 1, then 2, 3, 4, then from 5 to 11. While here 1, 2, 3, 4, 5, 6, 7, 8, then from 9 to 11. Okay, please focus. The first right posterior intercostal and the first left posterior intercostal are draining into the corresponding innominate vein. Then the first right posterior intercostal into the right innominate vein. The first left posterior intercostal into the left innominate vein. Then 2, 3, 4 here will be drained into superior intercostal vein. And here is also superior intercostal vein. But superior intercostal vein here is draining into azygos, while the superior intercostal vein here is draining into innominate. Then from 5 to 11 into azygos, while from 5 to 8 here into superior hemoazygos and here inferior hemiazygos. I think it will be simple. The first, right and left into innominate. Then 2, 3, 4 here and 2, 3, 4 here. 2, 3, 4 on the right side into superior intercostal vein into azygos arch. While 2, 3, 4 here into superior intercostal vein into innominate vein. While from 5 to 11 into azygos vein, and 5 to 8 into superior hemiazygos, while 8 from 9 to 11 into inferior hemiazygos. So please keep this.